I want to talk to you today about what I'm calling the nexus, the intersection of immoral and stupid. And when I hear the nexus of immoral and stupid, I think about a handful of members of Congress, and on that list is Republican Matt Gaetz. Matt Gaetz is voting against capping insulin prices to the end user. Now, it's crazy to use the term end user when we're talking about medicine. I agree with you. It's also a crazy situation because we are only talking about capping the price of insulin for the end user. So late last week, the House of Representatives passed a Democratic-sponsored bill to cap insulin at $35 a month for most Americans in terms of their out-of-pocket. Now, of course, you know and I know and anybody who's dealt with health insurance knows these things cost way more, but health insurance will pay part of it, and then there's a discount and blah, 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 blah. I know some of you were sick of this example, but it's been at least 6 months since I've made it an example. When I had my infamous appendectomy, you might remember that the sticker price was $35,000. Now, that's what the hospital billed my insurance. My insurance had said, sirs and ma'ams at the hospital, we know people sometimes have appendicitis. Will you contract with us for appendectomies for, I believe it was $11,000. So of the 30-something thousand that the hospital wanted, my insurance said, we are okay with 11, and I had a $2,000 deductible. So the $35,000 appendectomy ended up being $2,000 for me, and my insurance made up that other $9,000. Similarly with insulin, there are people now who pay over $1,000 a month. In the price, the actual price of insulin, MSRP sticker price, wouldn't even change with this bill. But the point here is insulin, guys, insulin. $35 a month, let's cap it. And Matt Gaetz says no. Why does Matt Gaetz say no? Basically because people should just lose weight. He wrongly thinks, not that it would really make a big difference, but he wrongly thinks only overweight people need insulin. Matt Gaetz saying, quote, while Democrat posturing of H.R. 6833 victimizes insulin payees as people with an uncontrollable disease that are being taken advantage of and need Big Brother to throw them a raft, lifestyle changes en masse would expeditiously lower demand and the subsequent prices of insulin. 90 to 95% of people with diabetes have type 2, which can be prevented or delayed with healthy lifestyle changes, such as losing weight, eating healthy food, and being active. Arbitrary price controls are no substitute for individual weight control. Since 2000, the number of diabetes cases in the U.S. has nearly doubled. The demand for insulin has increased, and the requisite price increase has followed suit. In other words, the price of insulin increases as waistlines increase. So, yes, he's a prick. Yes, of course. But he's also ignorant. Aside from this being asinine and disgusting and just horrible, it's not accurate. Type 1 diabetes is managed by taking insulin to control blood sugar. Type 2 diabetes, in more ways than type 1, is managed in other ways. This means medication. This means exercise. This means diet. And when I say medication, I mean a pill, not insulin. People with type 2 diabetes sometimes are prescribed insulin, but insulin is about type 1 diabetes. Insulin is for type 1 diabetes who are often perfectly fit. It is for type 1 diabetes for people who are not overweight. And there's a couple of different things here, and I don't even know where to start, to be totally honest, guys. I mean, on the one hand, should absolutely no condition related to our own actions be covered? Because then we're saying we're not covering lung cancer, most of which is related to cigarette smoking. We're not covering injuries that happen as a result of what we might call extreme sports or risky activities. We're not covering COVID stays for people who are unvaccinated. I mean, so first of all is this idea that, listen, I want people to live as healthy a lifestyle as possible, but are we really saying we shouldn't be covering costs for people who have certain conditions because of how those conditions develop? That seems very, very dangerous. Now, as I've said before, people will say, but David, sir, didn't you say that? If we have a full ER and you need to start putting COVID patients on ventilators, it seems okay as part of triaging limited resources to say the vaccinated people get the ventilator first because they're more likely to survive and they're more likely to follow medical directions as to their care. That is different than saying you're just not covered if you have type 2 diabetes. So that's number one. Number two, we've talked before about obesity seen as basically a moral failing. So putting aside that insulin is mostly for type 1 and Matt Gaetz is talking about type 2, this idea that we should only see obesity as a moral failing is wrong. At the same time, it should be okay to say that in the United States, lack of nutritional education leads people to eat persistently unhealthy diets for their entire lives. And we've got to be able to talk about that as well. But when we talk about obesity, we're talking about sometimes diet, sometimes genetic factors, sometimes underlying disease. There's a lot of different things. And again, seeing obesity as the big moral failing also is extraordinarily myopic. So, and the fat shaming and stuff like that does not appear to work. Matt Gaetz is disgusting. Insulin should be cheap to the end user. Maybe we call them the end customer or whatever the case may be. And he's vile for voting against this, and he's vile for his reasoning as well.
One of our sponsors is Blinkist, who's been supporting the David Pakman Show longer than any other sponsor. Blinkist is the app that lets you listen to or read an entire nonfiction book in just 15 minutes. Blinkist is the way to absorb those books you can't make time for. Blinkist takes top nonfiction titles, pulls out the book's key takeaways and insights, and gives it to you in the form of a text or audio explainer that you can consume in 15 minutes. With Blinkist, now you actually do have time to learn about all the things you've been wanting to tackle. On the Blinkist app, I just listened to This Is Your Mind on Plants by the great Michael Pollan. Super interesting, the history of caffeine and so many other things. Blinkist has you covered on podcasts too. Blinkist takes long episodes of popular podcasts and distills them into audio you can listen to in 15 minutes. With Blinkist, you can become knowledgeable about so many different things. You can have conversations with people about more topics. Blinkist makes you more well-rounded. Try Blinkist for free and get 25% off a subscription. Go to Blinkist.com/Pakman. The link is down below.